Shift our focus to the rise in the cases of COVID-19 that has now been reported once again, where the centre has now given caution to the states, with the top medical body, the ICMR, allaying the fourth wave fears. Listen into this exclusive interview that we are playing out on the certain guidelines that have also now been issued to the states.
Though the surge that we are seeing is, compared to the last 3 months, the surge is now picking up. But is it, in fact, do you think, because there are a lot of experts who have been saying that this could be a possible initial period of the fourth wave? So is it something that the ICMR believes too?
I would say that we do not have enough data or indication to say that it's a fourth wave. But I would say that this is a phenomenon which is being observed, so one needs to be really careful in terms of what does it mean, even if it is at a local level, and that's what I would say. But I would still underline that we need not to do panic, because panic does not help. However, one needs to really, promote COVID-appropriate behavior, and need to ensure that mask use goes high. Of course, there are projections, but projections are based on certain assumptions. So those assumptions might not hold true. So a projection is as good as the assumptions are. So we do not have the data coming up from the field, which says that now we have a variant which can give rise to a fourth wave. No, we do not have that sort of data. Actually, if a variant is a variant of concern, then only there is public health concern, and we call a variant of concern when there is clustering happening and the cluster grows in size, cluster of infections or infected individuals, or if the admission in the hospitals or the requirement for oxygen or the requirement of putting people on ventilators go high, but we are not seeing that happening. Like neither we are seeing a concerning level of admission happening in the hospital. Of the oxygen requirement of those who are infected, or even those who are infected, a considerable proportion of them requiring ventilators. That is not happening. So clinically speaking, these are all clinical parameters or indicators. Those are not indicating that we are seeing any variant of concern spreading around in the country as yet.
But do you think that the BA4 and the BA5 variant that we are witnessing right now, especially in Tamil Nadu and Maharashtra, there are experts who have been saying that those who were not positive or didn't get COVID positive during the third wave with Omicron might be the vulnerable ones this time, and they will get affected because of this variant?
I would say from public health perspective, be it BA4, BA5, doesn't really, for common mass, what should be the message? I would say those who are elderly, those who have comorbidity, or those who are suffering from cancer, or are, solid organ transplant patients, they should remain careful, irrespective of COVID, even if they get, other respiratory tract infections. So the messaging should be that they should protect themselves with the appropriate COVID-appropriate behavior, or they should protect themselves by mask. So that should be the focus.
But scientifically, is it possible
scientifically,
scientifically, is it possible that people who didn't get affected during the third wave might be the ones who might get affected this time with the surge that we're seeing?
If we say that if somebody did not get infected during the third wave, which is like it all started around October end or November and gradually went to peak in January this year. So for them, those who got symptomatic, they knew that they got infected. But there were many, because this infection was so transmission efficient, that huge number of people got infected without even knowing that they got infected, because it was asymptomatic. There were no symptoms. So those who did not get symptoms should not be assumed as individuals who did not get infected. So that kind of assumption that those who did not get infected during the third wave, now they will get infected. Well, the individuals whom we are assuming as not infected maybe actually got infected, because they were asymptomatic. So this kind of public health assumptions won't hold true.